Africa's health challenges are as diverse as its people. Tackling them needs coordinated efforts. The Africa Public Health Foundation started operations in a context marked by the devastating COVID-19 pandemic, with Africa Centers for Disease Control and Prevention, Africa CDC, playing a key and leading role in the continent's containment efforts. The situation required an appropriate response from Africa Public Health Foundation to secure funding. Africa Public Health Foundation's mandate is to forge partnerships and mobilize resources to support critical public health initiatives led by Africa CDC.
The creation of Africa CDC was a major achievement in the continent, and there was a major step forward by the heads of state of the African continent, because we have been through bad experiences, repeated experiences of pandemics, other health emergencies, and we were not properly organized in order to get a coordinated effort for the whole continent to deal with these bad situations. And we as APHF were created as an organization to support Africa CDC, mainly to provide a platform for partnerships and collaboration of several partners with Africa CDC, and mostly to mobilize resources for the programs of Africa CDC.
Africa CDC as a premier health agency is there to support the effort of the government to build resilient health security systems in a very unique way, to ensure that each country they have a functional the national public health institutions, which is well equipped, with a well trained, and have the necessary ability to bring all the public health assets in each country into the same platform, with the surveillance of the workforce, research, preparedness and response.
One of APHF's successes was the mobilization of resources that helped different African countries weather the COVID-19 pandemic. In Eswatini, APHF worked with Baphalali Eswatini Red Cross Society to reach citizens across the country with important prevention information.
When it comes to COVID-19, we were mainly focusing on passing awareness raising and messages to the people. We have about 5,000 volunteers countrywide. We then wanted to make use of that volunteer network to pass messages to the people, because surely we wanted everybody to get the messages about COVID. We were focusing more on a door-to-door campaign.
We did have radio programs that were being done by the government, but you find that there's some areas that people don't listen to the radio, or they don't have radio stations. But because Red Cross volunteers, we are everywhere in the country, and we are based in the communities, so it was easier for people to access information from the people that they know, people that they trust, who are within their communities, who are part of themselves. Initially, when the project started, it was at the height of COVID. Everyone was worried and there was a lot of misinformation. People were saying a lot of different things about COVID.
Like, for instance, when we talk of the injection, others would just tell us this is one way which is used by the whites to make sure that the population of Africans is being decreased.
They have the myth of this COVID. They said we have to use the traditional timbita. I don't know how to call timbita in English. They use timbita to remove COVID. Some of them, they use alcohol to remove COVID. So we just try to correct the myth that no, COVID, it's not all about, we have to go to the hospital so that they will give you treatment.
We trained 200 volunteers as a national society on how everyone can do COVID prevention, what to do when someone has tested positive in the family. That's the education that they would be giving to their families or in the houses, the homesteads that we were visiting. So the signs and symptoms of COVID, how to tell, and what steps to take should you find that someone in the family has symptoms. After testing, what happened, and those that were being treated at home to ensure that everyone had access to the treatment and they were taking the treatment. We trained them and they were given equipment thanks to the funding from our sponsors, Africa CDC and Africa Public Health Foundation. We were able to buy equipment for our volunteers for protection. They had masks, they have thermometers, they had sanitizers, and they had all the right tools to administer the questionnaires when they went out there.
Some of they welcome us very well. They also like what we were teaching them about. Some of the community members were not welcoming us very well. They chase us with the dogs. If they don't want us very well in their homestead, they allow dogs to come after us.
So it wasn't easy collecting data. Some of the households would allow you to collect the data from them, though some would still stand and say, we don't want anything to do with anything.
The total number of homesteads that we visited in the country are about 15,000 households that we visited. So the number of people that we were finding in each household could differ from 5, 7, 2, 3. So we did reach quite a number of people.
Coming to COVID-19, before our partners could help with the funding, we had to close our clinic because 4 of our nurses had conducted COVID-19, and we had to close the clinics because there were only 2 nurse volunteers who were not able to operate the clinic alone, so we had to close. So after recovering from that, we were lucky to get funding from Africa CDC and African Public Health Foundation. Yes, we were able to vaccinate all our nurses and staff. As we are speaking, we are all fully vaccinated, and we hope we will never conduct COVID-19. And if by chance we conduct it, the severity won't that much.
I think this is the way we should proceed, that we have to get the continent to take control of its own affairs and manage its own affairs in order to progress.
Africa Public Health Foundation, we are working towards a healthy, productive, and prosperous Africa.